Welcome back, amigos. I am Dr. Mario, and I want to give you the warmest of welcomes to Health, Spice, and Life show here with Dr. Mario. In this intimate, special setting, and you've been watching these programs before, you know that we call it El Cafecito Corner. If you like to watch things in Spanish or purely Spanish, we also have the version in Spanish, which is called El Rincón del Cafecito. Wherever you may be watching today from, whether it could be from France, it could be from Italy, it could be from Venezuela, it could be from Argentina, Puerto Rico, Ecuador, it doesn't matter. I want to give you the warmest of welcomes to this, your home, the home for 1 billion people who have not had representation in American TV, in doing this show about lifestyle, health, the things that really matter to us. Today, I am extremely excited here at El Cafecito Corner because we've started the series, which we call the Special Guest Series. You see, if you've been watching the show on national TV, you know that the time that we have to do the show on TV is actually rather short. In segments, they just happen to be that way, and they move very fast. Very often, we have segments with special guests that 5 minutes, they just simply don't do any justice to the quality of the content, the richness of what's being discussed, and the importance and the relevance of the topics that we are talking about. So in today's case, I reached out to a dear friend of mine who's been a big supporter and an advocate of Health, Spice, and Life show, Dr. Payman Sadeghi, to rejoin us in this intimate setting of El Cafecito Corner so we can expand and further discuss the topic that was brought on national TV regarding headaches during the times of the pandemic. So today, I want to give a very special welcome to Dr. Payman Sadeghi, who is the founder as well as the medical director of the National Institutes of Headaches, also known as its name NHI, which is really National Headache Institutes. And I want to welcome him to this space in a very different way because doctors were not used to having these long conversations where we just simply sit back, relax, and really expand on the topics that really matter to us and connect it in a way that you as a viewer can feel connected to the physician, but also you can learn something. Wherever you may be watching from, I'm going to invite you, if you haven't done so up to this point, to subscribe to whether our YouTube channel or you go to on social media, Facebook, or maybe on Instagram. And more importantly, take the time to share these episodes with as many people as you can. Why? Because as you know, if you've been following the show here, Health, Spice, and Life show with Dr. Mario, you know that one of the things that really fuels my tank and my motivation, my life, is to be able to share this with as many people as possible so that we can elevate the quality of people throughout the entire planet. Not just those who are part of that billion of Latinos or people that have Latino heritage or simply a strong inclination for everything that is Latino. So I want to extend the warmest of welcomes to my dear friend and colleague, Dr. Payman Sadeghi, to El Cafecito Corner of Health, Spice, and Life show. Dr. Sadeghi, welcome to the show.
Thank you very much, Dr. Mario. Excited to be here, and thanks for having me here. Thanks for your invite, and thanks for the warm introduction.
Such an honor to have you today. Thank you for sharing your time, which I know is really busy during these times of the pandemic. And if you're watching the show for the first time, like I said, the name of it is El Cafecito Corner. That's a segment that we do here, which is the more intimate one. And if it's El Cafecito Corner, we have to start with our beverage of choice. For me, it is espresso. I don't know what it may be for you. I want to ask Dr. Sadeghi, what is his beverage of choice for today?
Well, since I'm in Miami, it's the café con leche cubano.
Café con leche cubano. So, as I always like to say, whether if you don't like coffee, that's okay. Maybe you like tea. Maybe you like a typical type of juice that for you just does it. Or maybe you just like to drink some water. Maybe it's just some bubbly water. Whatever the beverage of choice is for you, I want to invite you to raise your cup with us. And like I like to say every single time, a tu salud.
Salud.
One of the great things, especially having a neurologist in today's show, is what a great way it is to be able to wake up our senses, especially whether it's the morning or maybe in the evening, wherever the time of the day may be, to feel alive and to actually do it through our mouth. So in my particular case, I like to describe what I'm drinking because it's a way for me to feel completely alive, be right here with you. And today I am drinking some coffee from Nicaragua. And the coffee beans have this very, very subtle, almost like a milk chocolate flavor to it. a little bit of vanilla there as well, and very, very creamy. And that's what I'm feeling right now. Maybe a little bit of blueberry notes also at the end of my drink. Dr. Sadeghi, I know you're drinking, Cuban café con leche, being in Miami today. Tell me a little bit about your drink and how it tastes.
Well, like any good Cuban coffee, of course, we can't get Cuban beans here, but these are roasted Cuban style. So they're very low acidity, so it doesn't have that tangy flavor, yet it's strong and low on bitterness. So I really enjoy it. And, of course, I'm having it with milk, so I can't, talk about the essence of it, but it's really nice on tongue, and it breaks up the senses, as you said.
Thanks for sharing that. Whatever you may be drinking this in this very moment as you share El Cafecito Corner with us, I sincerely hope and wish that you're enjoying it as much as we are in this moment. You see, some weeks ago, we had the pleasure of inviting Dr. Sadeghi to join the show and discuss what I believe is a really, really relevant topic, and is the fact that many people are presenting with headaches during the times of the pandemic. And headaches are one of the presenting symptoms. In other words, one of the things that first starts to happen as those infected with the virus start to feel the manifestations, the way that virus is coming through in their physical experience. So when I reached out to them so that he could be with us in the version of the national TV version of the show, I said, Dr. Sadeghi, let's really do a little dive into this whole thing of headaches during the time of the pandemic. And now in bringing him to the El Cafecito Corner version of the show, we have the luxury of more time so we can have a deeper dive into some of those aspects of headaches and how that relates to the pandemic. But moreover, what can we do if we are experiencing that? As you know, and you and I both have been during this time of quarantine staying at home. So we have this fear, or most of us have experienced that fear of leaving our homes to go and get anything, whether it's going to the grocery store, maybe going to the pharmacy, or simply not feeling well and saying, wow, well, I have to go to a hospital. I don't want to go to a hospital. That's where everybody is congregating, where everybody's coming together to be treated, be cared for. I just don't want any of that. So I figured it would be a relevant conversation to have with somebody who is a specialist and the founder of the National Headache Institute here in the United States to talk about what to do when these symptoms start to present, what to do in terms of navigating those symptoms so that you can help yourself in the process and ultimately know what to do if in fact there is something that it's prompting you to go for further care. In other words, to do things that you cannot do for yourself. Dr. Sadeghi, officially welcome to the show and to the segment. Let's just go right into it. Tell us about headaches during the time of the pandemic, please.
Sure. Well, thank you again. And the pandemic headache, as some call it, is a very curious thing, because one of the first things we saw during the lockdown, stay-at-home orders, is that the number of headache increased in patients who've been well controlled otherwise. So the question was, why is that going on? Is it, as you said, one of the first symptoms, or one of the prominent symptoms of the coronavirus is headache and spine pain, neck and back pain. And a lot of patients suffer from that and complain about that. So the big question was, is it coronavirus? Is it the stress? Or is it something else that's going on?
Yes.
So, I saw in a lot of patients that, I don't want to underestimate the coronavirus part, but I saw in a lot of patients at first that this is increasing because simply the stress of it, being at home. This is unknown territory. They're working more on their computers, on their phones, on their tablets. And as you know, the smaller the electronics get, the worse the posture gets. So we put more pressure on our neck and the nerves of the head, and that can trigger headaches. The other thing was sheer stress of coronavirus, hearing all the bad news around you, and all the death and all the cases, and is it going to happen to me or my family safe, and all that. The third one, being at home with all the family, especially kids. Kids are not going to school. Now moms and dads are transformed into teachers as well. So they're homeschooling kids. They're taking care of them more. They're running around them more. The stress and the energy they consume. So all of that, I think, initially contributed to the increase we saw in headache. Then, as the cases of coronavirus went up, the question became, all right, are we seeing more of these headaches? As you know, coronavirus has a very wide range of symptoms. It goes from no symptoms at all to the fatal symptoms and everything in between. So in essence, you could have just headache and back pain and neck pain without the fever. It's not the common, but it is possible and it has happened. So they had to be very careful on trying to recognizing those patients and those that suffer from just headache and different types of headache because of stress and whatever we mentioned first, or those patients that are infected with coronavirus and are having headache. Yeah, remember, just because coronavirus is out there doesn't mean that nothing else is happening and the only disease everything else exists. Coronavirus is just an addition to it. So that had us very on our edge.
That's a great point that I would like to emphasize and highlight that Dr. Sadeghi is saying, which is so true. The fact that we are overwhelmed in the medical world and in our personal lives with the fact that coronavirus is all over us right now, it doesn't mean that all the things that were happening up to the emergence of coronavirus simply just disappeared. He's absolutely right. And other things can actually present with headaches. So not everything that is just going to have fevers or headaches is like immediately coronavirus. So it is going to be important, and it's a bit of a conundrum when it comes to the medical professionals to be able to determine and go through the different types of analysis that we do so that we can arrive at the correct diagnosis and ultimately benefit you so that the course of action is the right one. Dr. Sadeghi, because of the fact that other conditions that we know about that can be life-threatening do present with headaches, what are the things that people at home should be thinking of when they present with a headache or they start to have headaches so that they can start leaning towards like, well, it's probably coronavirus, or no, it's something that is more severe that may require additional attention? Tell us a little bit, share with us, how do you think about these headaches and how can the audience start to get educated to decide and make better decisions about their health that ultimately will elevate their quality of life?
Sure. In order to raise our suspicion of it and be more careful, we have to, so let's talk about the patients in two different groups. There is the new onset headache, and then there are the patients who already have headache. So new onset headache has to be taken seriously. With or without coronavirus, you have to take it seriously, and you have to talk to a doctor and go through full workup. I hear a lot of times that patients tell me, I ask them, did you have headaches before? And they said, I just had regular headaches, normal headaches. There is no normal headache. There is no regular headache. Headache is a symptom and has to be looked into. So that group, very easy, straightforward. Now, the group of patients who had headaches beforehand is we have to pay attention to the difference in the headaches they're getting now. So if they have the same headache that they had before pandemic, it's just more frequent, more intense, all right, the level of suspicion is not zero, but it's still much lower. Now, if they have any difference in their headache, the intensity of it, the location of the headache, the type of headache, if it was throbbing when they had migraine and now it's pressure, it's burning, it's stabbing, then we should be taking it seriously. Or simply the same headache that they have, but it's not responding to medication. You take the usual medication and it used to work, and now it's not working. So all of those changes, all of those differences has to be taken seriously, and you have to talk with your doctor. And here I want to emphasize this point, Dr. Mario, that patients should not try to self-diagnose, or even worse, go to Dr. Google and ask, the internet, what's my signs and symptoms mean. So those can be very misleading. Talk to your doctor, get in touch with your doctor, and stay in touch with your doctor.
Excellent.
Yeah, telemedicine is a breach to do that.
That's excellent advice. And I just want to emphasize for you who may be watching, if you're joining us now, this is El Cafecito Corner of Health, Spice, and Life show with Dr. Mario. And Dr. Sadeghi, my special guest today, who's a neurologist and the founder and medical director of the National Headache Institute, just shares something that is extremely insightful. And it's the fact that when you are presenting with a headache, which is a subject today of headaches during the time of the pandemic or the pandemic headache, the aspect that we're looking for to be able to make a distinction, in other words, to be able to say, is this something that is just not that bad and I, run-of-the-mill headache, or is it something that needs to be taken care of, is the aspect of changes in quality of the headache. In other words, if you're somebody who happens to suffer from headaches on a somewhat or very regular basis, the neurologist, the doctor who's going to be looking at you to analyze those headaches and determine what else needs to be done or the severity of that, it starts off from, okay, you've been having headaches, but now those headaches, based on what you're telling me, are different. That's what we refer to as the quality. And the quality could be how often they happen, that's frequency, how often those headaches that are happening to you, how are they presenting? Are they stronger? Is the quality of them meaning that they used to be more like a throbbing pain and now it's like there all the time? There are different words, how we qualify, how we distinguish those headaches. And as Dr. Sadeghi is saying, if the quality of those headaches has changed and that is not going away, perhaps that is something that will require further attention, because it may be an indication that in fact we may be dealing, you as a patient may be dealing with something different. Isn't that the case, Dr. Sadeghi?
Yes, you got it right, and you summed it up really nicely. And that's, with a change in type and quality of the pain, we're not saying that, I don't want to scare people and say, oh, if that changed, you have the coronavirus, but it merits more attention. It may or may not be, but it merits more attention, absolutely. We have to work it.
Let's transition a little bit now, if we may, into, since there's so much fear that we have all experienced collectively all over the world about leaving our homes, right? The governments have been telling us you have to stay at home, you have to be wearing your masks, all of the things that we all know so well that have changed our lives significantly over the past many months. But because of that fear, what I have seen is that many people are not seeking medical care as they normally would because of the fear of going to places, whether it's hospitals or medical offices and so on, and being exposed to people that may have coronavirus in those settings. So given the fact that that fear is there, let's talk a little bit about if in fact somebody in the audience is experiencing headaches like we've been discussing today, what can we do at home in a do-it-yourself format to start supporting our health and supporting those headaches so that we can alleviate those symptoms if in fact they're not something more severe that needs and requires special medical attention right now?
Sure. So, sort of home remedies that we can say if your medication is not working fully, or you've checked with your doctor and everything's okay, but you're still having headache. Three things that I like really. The first thing and the easiest thing is pressure points. Pressure points are those hard points, different parts of for headache. It's usually in the neck and shoulder area, and patients know those points. So it is a science, but they know it somehow. Almost every patient says that when I have headache, this point here starts hurting and starts tightening, and then it goes to my eye and so on and so forth. So put your finger on those points simply and apply steady, firm pressure on it for a minute or two. Yeah, and that at first it's irritating, it's uncomfortable, and it may intensify the pain or radiate the pain. But if you keep the pressure on it, eventually that point will relax and the pain will get better. Another point that I like, which is farther from it, is one of the Chinese medicine points, one of the acupressure points, which is between the index finger and the thumb, closer to thumb, and you look for it, and it's again a hard nodule when you have pain, you have neck tightness, and you press on it for a few minutes. It is painful, it is uncomfortable, but keep the steady pressure on it, and it will release the pressure from your shoulder and your neck and some of the headache. And it works for dizziness and nausea too sometimes. So these are the pressure points. The second thing is the menthol ointment that you can buy over the counter at any pharmacy. And just take a little bit of it, rub it behind your ears, behind the bone of the ear, base of the head, and temples, and massage it a little bit. Don't get close to your eyes because the vapor of it is very uncomfortable. The cool feeling of the menthol ointment kind of relaxes the muscles, reduces the inflammation of the nerves, and provides comfort. And sometimes it works even for nausea that comes with headache. Third, definitely not the least, is warm compresses. You know, most of us have heat packs. We put it in the microwave, we plug it in the electricity, put it on your neck, base of the head, neck, and shoulder, and it relieves the muscle tension. If you don't have the heat packs, getting a hand towel, a bigger hand towel, roll it, dip it in water, and squeeze the extra water out, put it in the microwave for a few seconds, depending on the power of your microwave, and then put it there, or make the water hot, and just when you squeeze it, just put it there directly on your neck. With this, you gotta be careful that the water is not too hot, you don't microwave it too long so you don't burn yourself. And actually there have been instances that people were in so much pain that they used too much heat for more comfort and they got second-degree burns, some of them even. So be very careful of that. Those are home remedies, but I want to emphasize the importance of keeping in touch with your doctors. I don't want to ignore, even if these remedies work, I don't want you to ignore the importance of being worked up and being looked at. So don't go to ERs. Of course, I don't want to send anybody to urgent care or ER because those are the epicenters of coronavirus. But telemedicine is the greatest thing that happened to medicine. We've always had telemedicine in our practice, and now it's fully integrated, and a lot of other doctors have it integrated, and it's been a savior for my patients and me. So and how I communicate with patients, and that's the safest thing, the best thing.
I love the fact that you've shared some things that are also part of the non-traditional medical system. You're talking about some of the things that have been known for thousands of years in Oriental medicine, Chinese medicine, particularly speaking about the acupressure points. So it's very important to recognize in these modalities that Dr. Sadeghi has shared with us here in the show that there are things that we can do at home, whether it's the acupressure points that he talked about, whether it's behind your ears, temples, or in some cases, between your first and your second finger, but also things that are very common that are not medications, such as putting menthol in those areas that he discussed as well. And I love the fact as well that he's saying, well, you can use a warm compress. If you don't have a heat pack, you can make your own. Always keeping in mind that if you're going to heat it up, we do not want to cause another problem, such as burning your skin. Super, super important. And he also touched on telemedicine. In other words, we may feel at times like there is no solution for us, that we're alone, that we're separate, that we can't go to places where we used to go. And to a large extent, that's actually true. But the fact that technology can be leveraged, in other words, technology can be used, such as telemedicine, to be able to have access to healthcare practitioners, it really keeps the doors open so that the needs that we have in our experience of health can be satisfied, can be catered to, so that we do not end up having bigger issues. Very often, Dr. Sadeghi, many people think that doctors, nurses, and so on, medical personnel is immune to not getting sick. And I want you to please share that story of a bit of a conundrum, a challenge that you had in your particular personal professional experience when one of your teammates was having some symptoms and decisions needed to be made about how to go about it. I just want you to share that because as physicians, we have to deal with these things. And as we know from listening to the media and reading newspapers and so on, we know that unfortunately many, many healthcare workers from all over the world have died because of being diseased with the coronavirus. So tell us a little bit about how that touched you personally and your team as well.
Sure, sure. Yeah, that's a great point. Everybody thinks, oh, doctors are not supposed to get sick, but we're human too. All the healthcare providers, whatever their degree or their role, they're humans too, and they will get sick. So, as you said, a lot of healthcare providers, especially first-line healthcare providers, have died of the virus, and they are truly heroes that they went there and they took care of patients and took it upon, they didn't think of themselves. But one of my personal experience was that in our office one day late at night, they had a call from one of our staff in Miami office, and she had a bad headache and chills basically. So she was wondering if she could come in and I could give her some injections so that her headache goes away. So the first thing that comes to my mind is what we've been talking about on this interview from the beginning: coronavirus and headache. Throw chills in it, which could be fever. Then we could have a recipe for disaster, and it could bring someone in with the virus and spread it in the office.
Yes.
And affect a lot of people. So we have to be careful on that. So we had to make a difficult decision because I wanted to help her. It hurts me that people are suffering, but at the same time, I had to make a difficult decision that you gotta go and get tested, and if the test is negative, then we help you. We bring you in and do whatever we need. So fortunately, it turned out that she did not have the coronavirus. Which brings up another important point that we touched on earlier. But if you because you have a pandemic with coronavirus doesn't mean that all other conditions are out and they're not active and they're dead. No. You have everything that was happening before, and you just added a new condition on top of it. So that's another thing that we have to be very cognizant of and very careful.
Dr. Sadeghi, we have the telemedicine piece that we've talked about, and the things that we can do at home. What things concern you as a neurologist that you say to yourself, okay, this is the kind of patient that definitely it warrants to be seen in the ER? What things do you look for that really concern you? Because if somebody's watching the show right now and they've gone through all of the things or remedies, or maybe they now go and start applying some of the things that we've given them, however, it doesn't go away, when do you start to get concerned? Okay, this kind of patient definitely must be physically seen by somebody and go to the ER.
So to send to someone to the ER in these times, I am very careful who do I recommend. So I gotta be very certain of it. I try to take care of the people who are low risk for coronavirus in the office. So, for example, we have a patient who takes care of her elderly mom, and she has self-quarantined beautifully. She doesn't even let her family come in. So she suffers from bad migraines, and I didn't want to send her to ER. So I had her come in, we're gonna put her in a disinfected room. We don't let anybody go in that room for a day at least, and we fog it with disinfectant and everything so that we can take care of her, and then she goes back and go home in her own car. So we're very careful not to send it. But if the symptoms are suspicious of coronavirus with fever, especially fever and cough and headache and spine pain, then I send the patients to ER, mostly to get taken care of for that and get tested to be sure that we are dealing with that. And this too, the ERs today are different from ERs in March, when the pandemic started, because now we've learned more about it, so they are more careful, there is more isolation, they have more time to arrange things. It is still not the safest place on earth, but it's much safer than what it was 4 months ago.
Definitely. Dr. Sadeghi, let's talk a little bit about some of the things that can be done to support our immune system as we go through this pandemic. And before we head into that, I'm just going to say to our audience, you're tuning in to Health Spice and Life Show, El Cafecito Corner, the most intimate corner we have within the show. with our special guest today in the special guest series of the show with Dr. Payman Sadeghi, the founder and national medical director of the National Headache Institutes based out in Miami, Florida, and Houston, Texas in the United States. And we've been talking about headaches during the time of the pandemic. Wherever you may be watching from, send us a comment, let us know where you're watching from so that we can connect with you. And if this is the first time that you're watching the show, welcome. Subscribe to the YouTube channel, Facebook, or maybe on Instagram. Just let us know you're out there, you're watching us so that we can be in contact with you and let you know when the show is going on national TV or we're having new editions of the different shows that we do through social media. So going back to this topic, Dr. Sadeghi, what can people do to support your immune system? And I know that you're a strong advocate of a particular modality.
Sure, yeah. So, first of all, prevention is everything, right? Because this is such a new condition, we don't know how to deal with it. We don't even know if it causes pneumonia or is it causing blood clots in the lung. We don't know anything about it. So prevention, prevention, prevention. Washing hands frequently. Using, if you don't have access to soap and water, hand sanitizer. You know, nowadays there was a shortage, but thankfully nowadays you can find them anywhere and everywhere. So have a small bottle in your spray in your pocket all the time. Don't touch your face. Don't touch your eyes. Wear masks. Wear masks. That's a respect for other people and yourself. So you're protecting yourself as much as other people. Those are the things that you can do on your own, of course. But something that we can do for you is IV nutritions with immune boost nutrients, such as vitamins and minerals, particularly vitamin C. You know, it doesn't prevent you from getting the disease, of course, but it builds a wall, a defense wall. I sort of compare it to wearing sunblock for sun. You know, it reduces your chance of skin cancer, but it doesn't make it zero. So same thing with the IV immune boosting nutritions for these times.
This is a great suggestion, and I really like it a lot. And I like the metaphor you're using of putting sunblock inside of your body. You see, if you're watching this right now, your body, my body, Dr. Sadeghi's body are constantly exposed to many pathogens. In other words, many different forms of organisms that can get us sick, whether it's bacteria, fungi, viruses, and so on. And your resilience, how strong your immune system is, in many ways can dictate if in fact you will be susceptible to one of those or not. There are many factors that are part of that, whether it's also your genetic constitution, your lifestyle, your diet, and so on. So it's not just one thing. But to his point, which I think is extremely valuable, if we're taking those precautionary steps, those preventive steps, to be able to support that immunity, that defense, innate defense that we have inside of us, and keeping those levels of immunity as strong as possible can lessen your possibility of being in a state where you can contract, where you can actually get this virus to truly unleash inside of you and get infected. So that is a huge aspect of it. Prevention is truly the best medicine. We in medicine, we talk about this all the time. And to be honest, not always is the easiest thing, particularly if we're not aware that that is something that is available to us to do. Dr. Sadeghi, I would like you to leave the audience with some parting thought as to what is your best kept secret as a neurologist in these times so that we can take that with you and make it memorable for us as we remember you in this segment.
Sure, thank you for the opportunity. You know, my best kept secret is actually not a secret at all in these times. I want to emphasize on the importance of prevention, because this is a disease that is new to all of us, and we don't know what it's going to cause. You know, every day we hear something new about it. Oh, it's attacking the nervous system. Oh, it attacks the meninges. So some patients are having residual neurological problems with it. So the best way to protect yourself from this virus is not to get it. The best cure is prevention. And be in touch with your doctors. Telemedicine is the greatest thing. Don't be afraid of it. You can talk to your doctor from the comfort of your living room, or if you don't feel good enough to get out of bed, from your bed, just a phone, and everybody has smartphones nowadays. So keep those things, keep healthy, and take care of yourself.
I love that. So the two main things that I want to leave you with, as Dr. Sadeghi has said, and to re-emphasize his best-kept secret, number one is prevention. And the second thing is to leverage technology, whether it's your phone, there's so much available to you in that, whether it's your tablet, if you happen to have one, or your computer. It is such an amazing portal, it's such a door to incredible connection with professionals who could support you. So don't be afraid, like you said, it's available to us. This is a time to really use technology to our favor as we navigate these difficult times, which are so confusing for so many. And as Dr. Sadeghi is saying, we are still understanding, learning about this process. What is it? What does it do? And moreover, things that we don't know, what will be the lasting impact that this will leave in our bodies? Before we wrap it up on today's version of El Cafecito Corner of Health, Spice, and Life Show with Dr. Mario, I would like to invite Dr. Sadeghi to share with us where can we find him, what are the different phone numbers and the institute information, the National Headache Institute, so that if you want to reach out to him or his staff, we can have access to doing so and connecting with them.
Sure, thank you for that. So the best way to learn more about us is on our website, nationalheadacheinstitute.com, one word. And the phone number in Miami office is 305-440-5969. And by calling Miami, you have access to all of our offices because we sort of work as one unit. We have inter-office communication. So those are the good information to have. And if you have any questions, we're here to help you and we'll guide you as best we can.
Dr. Sadeghi is also on social media, and we will make sure that you can see all the information right here underneath the screen, and also the links for his information will also be posted, so that if you have any challenges in your health, or maybe a loved one, a friend, or so on, you can reach out to them and get supported. His commitment, along with his team, to support people's health, particularly in the aspect of neurological conditions, is superb. I know it. He is a heart-centered physician who is really interested and committed, most importantly, to supporting people's lives and health through what they do best. Today, we have had the honor and the pleasure of spending time with Dr. Payman Sadeghi, the founder and medical director of the National Headache Institute, with offices in the city of Miami, in the state of Florida here in the United States, as well as Houston in the state of Texas. We're deeply grateful for his presence, sharing his time, and also caring about this important topic that is afflicting so many people all over the world. So once again, thank you for being here with us at Health, Spice, and Life Show with Dr. Mario, El Cafecito Corner. Don't forget to subscribe. Don't forget to follow us on social media, whether it's Facebook or Instagram, or subscribing to our YouTube channel. Two things that I want to leave you with that are super important to me. Without a community, this is absolutely nothing. So it is so important for us here in the team at the Health, Spice, and Life Show to know where you're at in the world. Let us know, send us a message, comment here on the different social media outlets. Let us know how this has impacted your life. And the second piece, which is even more important than that, is the fact of sharing. Sharing this information that we have brought to you can truly, and I believe this, make a difference in people's lives, alter the way they're doing the living, and more important, in this incredibly tough times for all of us across the planet, to navigate this condition, this pandemic of coronavirus. As we have been saying in today's show, headaches could be the presenting symptom, but it could also be the indication of something that is deeper, that is more serious, that requires attention in a different way. So please share the information with others, as you may be making a difference to people in ways that you can't even imagine. As I like to say at the end of every single time that we meet here at El Cafecito Corner, from my heart to your heart, I am Dr. Mario saying to you, a tu salud. See you next time.